Well, 3 weeks into the rollout of Minnesota's medical marijuana program, the numbers of patients enrolling continues to be lower than many expected. Patients say the problem is that their doctors won't help them sign up. So far, only 298 healthcare practitioners have registered with the state, and only 183 patients have been approved in the state registry to pick up their prescriptions. In a survey of Minnesota doctors, the Minnesota Medical Association found strong opposition among doctors to the program. The survey found that 68% of Minnesota doctors say they won't take part in the program. Only 9% say they will. 17% say they are undecided, and 7% say their patients wouldn't qualify. Joining us to talk about why so many doctors are not on board with this program is the president-elect of the Minnesota Medical Association, Dr. David Thorson. Dr. Thorson, thank you so much for coming in.
Thank you for inviting me.
All right. Dr. Thorson, what's the problem here? Why are doctors saying that they're not going to take part in this?
I think it's a complex problem. The physicians really do empathize with these patients who have tried other things and have not found something that worked, but we're also held accountable for doing evidence-based medicine, and there really isn't much evidence for medical marijuana yet because of the way it's been classified by the federal government as a Schedule I drug, similar to heroin and other drugs. We can't even do studies on them. So physicians are saying, how do I hand my patient off to somebody else, certifying that they have a disease, and have a shared decision-making conversation with the patient, talking to them about risk, benefits, potential side effects, and then hand them off and have no idea what they're getting.
What the doctors are being asked to do, though, is to say, yes, patient A has one of the 9 medical conditions. Basically, the doctor's being asked to say, yes, this patient has glaucoma, which I think if most doctors, if you ask them to write a letter, they probably would. What's the problem here? Is it the fact that it's the doctor that's got to get the patient into the state system?
I think that's part of it. The doctor was put in the position of saying, I have to certify that they have an illness and by certifying they have an illness, understand that they are going to be going to have marijuana dispensed to them by a pharmacist. There's a lack of bidirectional communication. We hand this off to a pharmacist, and we have no idea what dosage they're getting, what ratio of dosage of medications they're getting, and if they have side effects, how we're going to find out other than them calling our office and us having to call them.
Because that's what I've heard from some doctors. What you just said is they don't like the fact that under this program, it's the pharmacists who have complete control over the prescription. I've talked to lawmakers who say that doctors, when they were writing this bill, didn't want to write the prescriptions. They said, we just don't want to deal with that. So which is it?
Well, there's a problem in the fact that it is an illegal drug. If doctors wrote the prescription, they could lose their license to dispense. So this was put up as a firewall to allow physicians to maintain their license, yet certifying an illness that the pharmacist could then use as dispensing information for dispensing the medical marijuana.
Okay. I have also talked to doctors who have told me that initially they said that they were willing to sign up their patients, but then the group practice they work with looked at this and said, no, we are not going to take part. Are there physicians who would like to take part but are being blocked by large group practices, which most doctors are members of?
We've heard anecdotal stories of that. We have not done a survey to find out were you willing to do it, but your group said no. I know we've talked to a number of different groups who have had different approaches to this. Some say that they'll allow individual physicians to still do it. Others have said they are going to have a certifier for multiple physicians, which the state now allows. I have not been informed of any group that has actually said, absolutely no, we will not do it as an organization.
All right. Is there a system that you can think of that would allow patients who want access to this, who have one of these conditions, to get access in a way where the doctors wouldn't feel so compromised?
I think that having bidirectional communication from the pharmacist, so we have that ability to know exactly what they're dispensing, so we can then look at other medications that they have and be able to find possible side effects if we're getting called about them. I think getting it reclassified, rescheduled as a Schedule II, so we can actually do studies and get the evidence behind it.
That's a tough one there, but perhaps tweaking the law would help, you're saying, so that pharmacists, doctors would be involved with the actual prescribing.
Right. Right now, we have no idea what the pharmacist is dispensing. So we can't even put in our electronic health record to say, this is what else they're on top of these other meds, to know what side effects are.
All right. Well, Dr. David Thorson, thank you so much for coming in. We certainly appreciate your viewpoint and explaining the doctor's side of this.
Thank you very much.